Health Check was proudly brought to you by First Capital Bank. Belief comes first.
Good morning, and you're joining me and Dr. B on the Health Check, given to you by myself, Dr. Bhagat, and First Capital Bank. Good morning, Dr. B.
You sound like you got more energy than I have.
After I told you what I just told you. Yes, no, I have to have the energy, Dr. B. I'm so excited as well about the topic. You know me, I like it gross. So today we're talking about runny stomachs and the different conditions, right?
Yeah, well, on the Health Check, we actually try and encourage people to become their own doctors. And
Yes.
when it comes to a running stomach, it's pretty much like everything else. Probably it's something that you did, and it's a common complaint, and people often run to go and grab an Imodium or something to stop the diarrhea before actually asking what they've done. So the most important thing about running stomach is it's very common. Many people have it at least 2 or 3 times a year. And when your stomach does run, it's usually complaining about something, and that something may well be something that you've done. It may be something that you've eaten that you're intolerant to, and the classic one are dairy products. Probably 75% of us cannot tolerate lactose, and so you have something that's got sort of dairy in it. Your stomach will run, or it'll gas, and it'll complain to you. If your stomach sort of does the rings around you, and you get this bloating, you get this cramping, you get a running, almost explosive diarrhea.
Yes.
It means it's trying to expel something, and the common notion, Zoo, is to rush to the chemist to get something to slow down the bowel. But remember, when the bowel is actually having diarrhea, it's trying to get rid of something that's in there, whether it's an antibiotic that you've taken that it's reacting to, whether it's medication that you may be taking chronically that you haven't informed your doctor that this thing doesn't make me feel well, or whether it's food that you've taken that you shouldn't be taking. Because if you're your own Sherlock Holmes, you can actually work out to say whenever I have milk, or whenever I have quinoa, or whenever I eat spinach, my stomach really doesn't like it at all. Artificial sweeteners, lactose intolerance, medication, and then of course the common one that everybody fears is our viral infections and bacterial infections. And we're going into winter, so there is such a thing as gastric flu, where the flu, instead of getting primarily into your chest, goes into your gut, and it inflames the gut, and you get this sort of watery, running stomach, and that's
Wow.
a viral flu. So it's caused by viruses such as adenovirus, astrovirus, cytomegalovirus, and more recently, COVID. COVID diarrhea may be the only presentation of COVID that you've had. So
Wait, Dr. Bhagat, did you just say COVID diarrhea?
Yeah, absolutely.
I didn't know that there was a diarrhea that COVID even had anything to do with.
Absolutely. Now we've got a listing, and a study reported in the American Journal of Gastroenterology earlier this month found that diarrhea was the first and only symptom experienced by some patients. So this is science. It's really important to understand that. And we haven't got much time, but somebody's asked here, when should I worry about diarrhea? Well, you should worry if it goes on for more than 2 days. You should worry if it comes together with a fever. You should worry if you're going probably 4 or 5 times a day in a 24-hour cycle, if that's the case. And you should always worry if the diarrhea comes with severe, unbearable pain in the tummy or your bum, and particularly if there are different types of diarrhea, and everybody knows about this. I know it's a horrible subject to talk about, but it's common.
Yeah.
If it's watery, it generally suggests that it's something you're allergic to. It may be what you've eaten, or it may be an antibiotic. If it's bloody, if it's got mucus and it's sort of bloody, then you've got to worry about it, because it means something's going on in your stomach that's really violently reacting to it. And it may be a sign of what we call inflammatory bowel disease.
Yes.
A lot of people come to us really quite late, where they've had these symptoms. They've been treating it with antidiarrheal preparations, when actually what they have is an entire inflammation of the body. It's called Crohn's or ulcerative colitis, and that is a condition where it's an autoimmune condition which results in very severe issues which need a specialist attention. It may also be that you have malabsorption. Malabsorption means you're not producing the right digestive enzymes, because the pancreas is faulty. The pancreas is the organ in your body that produces enzymes to break down food. And so when you're flushing the loo and you're having a running stomach, and your poo floats on the toilet pan,
Yeah.
it means you've got food that has not been digested, and it suggests
The fat is
the pancreas. So this, we've talked about this before. Inspect sounds horrible, but inspect your poo every now and again, because it actually is something that will tell you so much about you. And somebody asked what cancers can cause diarrhea. Cancers very rarely cause diarrhea, but colon cancer, cancer of the thyroid, pancreatic cancer can cause it. But diarrhea is often something that you can do by trial and error and work out what you've done.
Yes.
Somebody can stress cause diarrhea? Well, I mean, the person who's asked that should know. Every one of us knows when you're about to give a presentation or when you're really going to meet your boss for something you've done wrong, you start feeling like you need to go and rush to the loo. And that's because your adrenaline is on a high and your stomach is cramping. And definitely stress and anxiety can cause this. Somebody's asked, what is explosive diarrhea? Explosive diarrhea is simply when the rectum fills with more fluid and gas than it can hold. That's all
My
it is.
goodness, yes. When it gets really crazy.
Do we have some time? I've got some serious questions.
Maybe we can
seconds.
just do a minute. Yeah, let's just do a minute, yes.
Okay. Somebody's asked, when is diarrhea serious in adults? Diarrhea that lasts more than 2 days without improvement, that comes with excessive thirst, dry mouth, little urination, weakness, dizziness, lightheadedness,
My
dark
goodness,
colored
yes.
urine. It tends to be something that you need to be serious about. And somebody's asked here, what foods slow down diarrhea? And this will be my last one because it's a good question.
Okay.
A good bit of advice, and I think it's mum's advice also, is to eat foods that we call in medicine the brat diet, which means bananas, rice, applesauce and toast. All these things contain something called pectin. Pectin slows down the diarrhea. So if you eat 1 or 2 bananas, it contains enough pectin to actually slow down the diarrhea. So there's some good advice.
Perfect. Well, I love that, Dr. B. Would you like to let them know what we're talking about next week, or you want to keep it a surprise?
Let's talk, because people are expecting it now. We've got some, we've got some really expectant listeners. Next week we're going to be talking about something that is very common. It's not a disease, but it affects many women as they go through that change in life. The chapter between the morning and the afternoon of life is called menopause. And we're going to talk about the symptoms of menopause and how you manage this natural condition, but can really afflict many women in an uncomfortable way.
Definitely. And my mom is going through that right now, and it's crazy. It's crazy, Dr. B.
See you next week, Sue.
Thank you, Dr. B. All right. So as you heard, Dr. B, we were focusing a lot on gut health. That's your runny stomach and what happens to you and the symptoms to look for. And if you're looking for more information on the gut health and what Dr. Bhagat and I were talking about, you can definitely reach out to him on the Heart Foundation on Facebook. That is the Heart Foundation. Otherwise, follow me on the House of Zoo and you'll get more information on First Capital Bank and the Health Check with Dr. B.
Health Check is proudly brought to you by First Capital Bank. Belief comes first.
FM.